On your Health Watch tonight, under the Trump administration, the Department of Health and Human Services are working to eliminate billions in funding with the National Institutes of Health.
The NIH is the federal agency for medical research, leaving many concerned about the impact of those cuts.
The reporter Tristan Susel spoke with a woman in Denver fighting cancer who's relied on research and clinical trials to stay alive.
Every day, Katie Doble gets on her computer looking to connect with anyone who might share her fight for clinical research, knowing her life and countless others depend on it.
I share my story to give people hope and also to show people the importance of clinical research.
In 2013, Katie was diagnosed with ocular melanoma, a rare form of cancer that spread from her eye to her liver a year later. There were no FDA-approved treatments available, meaning the diagnosis was terminal.
My doctor told me I had basically 16 months to live.
Just 2 days later, her now husband proposed.
I was like, okay, am I planning a funeral or am I planning a wedding? And Nick and I just made a commitment that we were just going to keep looking towards the future.
With her husband and family by her side, Katie spent her 30s in and out of clinical trials all over the country.
My second 2 trials were here locally, and that ended up buying me quite a lot of time with my liver. In 2018, it spread to my brain. In 2020, I had growth again, and that's when I ended up in my 4th clinical trial.
The treatment was a success. Since 2021, there's been no sign of cancer.
To have metastatic uveal melanoma and then become no evidence of disease is unheard of.
But the possibility of needing to participate in another clinical trial in the future still exists.
Here we are 10 years later, and there are still no FDA-approved treatment options.
Recent staff and looming federal spending cuts has made Katie's work even more important. The U.S. Department of Health and Human Services announced layoffs and an intent to cut spending on contracts by 35% across all its divisions. That includes the National Institutes of Health. NIH is the world's largest source of funding for medical research.
When someone leaves NIH, they don't take their years or decades of research with them. All of that work, all of that research gets lost.
Katie, motivated now more than ever to share her story.
I am someone who is alive today because of clinical research. If our doctors can't speak up, we need to.
Tristan Susel, covering Colorado First.
Katie is amazing.
Yeah, she really is. An inspirational story. Great message.
Yeah. Tristan, thank you for that.